Hey guys, so today we'll be talking about the effects of medications and substance abuse on the growth of a fetus. So when we look at substance abuse during pregnancy or using certain medications during pregnancy, what happens is that during the 3rd and the 8th week, which is the period between embryogenesis and organogenesis, which is the formation of organs, this is the most susceptible period for the growth of organs to go wrong, essentially. And this is the period where teratogenicity can happen. And we're going to be looking at different medications that can cause different effects. And we'll go through each one of them and hopefully go through each of them and find helpful ways to remember them. So let's start with some of the medications that can cause teratogenicity during embryogenesis. So the first one we'll look at is ACE inhibitors. So ACE inhibitors are primarily a medication that's used in control of blood pressure, and it's usually one of the very first medications used and very effective medication for blood pressure. So ACE inhibitors, if used, are teratogenic and can cause renal failure, oligohydramnios, and Hypocalvaria. So, a good way to remember the effects of ACE inhibitor on fetal growth is the fact that ACE inhibitors are used in control of blood pressure and they're considered renoprotective as well. If they're considered renoprotective, the renal aspect should stick in your head, and remember that ACE inhibitors can cause renal failure. So, babies that are born whose mothers use ACE inhibitors unfortunately may end up having renal agenesis, for example. So renal failure is a big cause. Now the kidney or the renal system is very important in the whole movement of fluid excretion of waste and things like that. So oligohydramnios is defined as a low amount of amniotic fluid within the amniotic sac, and this can sometimes happen due to fetal abnormalities. Usually the oligohydramnios is measured as a fluid pocket, and the normal range for this, or the amniotic fluid index, the normal range of this amniotic fluid index is usually between 8 to 24, and less than 8 is considered oligohydramnios. So if you remember the fact that ACE inhibitors are renoprotective and can cause renal agenesis, for example, just remember the fact that because there's inefficient fluid distribution that's going on, oligohydramnios is a possible complication as well. Now the third one to remember, this is actually an extremely rare occurrence, hypocalvaria, which is basically the hypoplasia of the skull bones to form, which is extremely rare, but it's one worth remembering. It's an interesting one. So just remember, the skull bones don't form. What does the skull contain? The brain. So to ace an exam, you need to have a brain, right? So what does ACE inhibitors do? They basically block the formation of the skull bones. So just you can remember it that way. So renal failure, oligohydramnios, and hypocalvaria. Now, the next one that we can look at is alkylating agents. So alkylating agents are usually used in fighting cancer. So alkylating agents can include something like busulfan. And busulfan, obviously, as we all know, the chemo side effect can be pulmonary toxicity. It can damage the lungs. So with alkylating agents, what you will have is usually with alkylating agents, what can happen are absence of digits, and multiple anomalies. So just think of it this way. Alkylating agents are in chemotherapy, for example, as part of chemotherapeutic approach. So in this, you are destroying cells. You're destroying cells, destroying tissue sometimes as well. Think of it that way. You will have absence of digits and multiple anomalies. Toxicity of aminoglycoside. Now this is a big one, and it can be commonly asked not only for fetal growth but also in adults as a side effect. Aminoglycosides, one of the most important side effects or on fetal growth we have to remember is ototoxicity. It can cause toxicity to the ears, resulting in sensory neural hearing loss. Another important side effect, not necessarily fetal, but an important side effect of aminoglycoside to note is nephrotoxicity. So you have to monitor the renal function while using aminoglycosides. Okay. Next drug we can go towards is anti-epileptic drugs. Okay. Anti-epileptic drugs. Now there are a lot of anti-epileptic drugs that are used. Okay. But we'll focus on some of the clear ones that we need to know. Okay. So some of the main ones we need to know. So for example, one of the main sort of questions you may see with regards to anti-epileptic drugs would be the use of phenytoin, right? Phenytoin during pregnancy, okay, can cause something called fetal hydantoin syndrome. Okay, fetal hydantoin syndrome. So what this encompasses is neural tube defects. It can encompass cardiac defects. Okay, cleft palate, skeletal abnormalities. Okay, so skeletal abnormalities can include things like facial dysmorphism, it can include phalanx or nail hypoplasia. So let's go through this. So in an anti-epileptic drug, think of it this way. If you're using something like phenytoin for seizures occur when you have disturbed excessive neuronal activity in the brain. Okay, so it's to do with the brain, the CNS system. So think of the CNS system, neural tube defects. The neural tube essentially is important in the development of your CNS. Okay, it is very important. So think of it that way, in the sense that your neural tube defects can occur, your cardiac defects can occur. Phenytoin, just think of, there's one way to remember it, Phenny. Phenny essentially is a local alcohol drink that you can remember. Phenny is found in India. It's a local alcohol drink that you can find in places like Goa, for example. So what does Phenny cause? Phenny, being alcohol, can cause heart problems, right? Can cause alcoholic cardiomyopathy. So if you think of alcohol, phenytoin can cause cardiac defects. Okay, coming back to the actual CNS, the face, the head, you're looking at things like cleft palate as well. Okay, cleft palate, and the brain is important for growth as well. So you're thinking of skeletal abnormalities there. So you're looking at facial dysmorphisms and phalanx, which is basically your fingers, or nail hypoplasia. Okay, so with anti-epileptic drugs such as phenytoin, you're looking at effects such as neural tube defects, cardiac defects, cleft palate, skeletal abnormalities such as facial dysmorphism, and phalanx or nail hypoplasia. Okay, the next one we can look towards use of diethylstilbestrol, commonly known as DES. Okay, with DES, the most common association you will hear is that it can cause vaginal clear cell adenocarcinoma. Okay, so usually with vaginal cancers, the most common vaginal cancer is the squamous cell carcinoma. But here, with DES exposure, you will be thinking of clear cell adenocarcinoma. DES is associated with vaginal clear cell adenocarcinoma. Okay, with regards to fetal growth, the important one to remember is your congenital Malarian abnormalities. Okay, congenital Malarian abnormalities. So your Malarian duct, your Wolffian duct, if you're familiar with your embryology in the reproductive system, is important for your reproductive organ growth, for example. So with DES exposure, you would have congenital Malarian abnormalities. The way to remember this, if you remember that DES is associated with vaginal clear cell adenocarcinoma, is to do with the reproductive organ, it can also have an effect in the fetal stage as a congenital Malarian abnormality as well. Okay, with regards to fluoroquinolones. Now, fluoroquinolones, not gonna lie, it's actually one of my favorite drugs. Just because it's got a wide range of use as well, but at the same time, the side effects are sort of a little out there. It's interesting to me, just to understand them. So fluoroquinolones such as your ciprofloxacin, levofloxacin, moxifloxacin, as you can imagine all of these end with fluoxetine. Okay, so fluoroquinolones such as your ciprofloxacin are used in a wide range of settings with regards to, it can be used in treatment of community-acquired pneumonia, it can be used in treatment of urinary tract infections, but also important side effects exist for fluoroquinolones. So in the fetal stage, the most important one is cartilage damage. Okay, cartilage damage. So cartilage damage can manifest as something like, essentially, for example, your Achilles tendon. Okay, so your Achilles tendon, you can remember in adults that use of fluoroquinolones can cause tendon damage and potential tendon rupture as well. If you imagine that, it can, and relate that to cartilage, it can cause fetal cartilage damage as well. Okay, other side effects that are important to note from fluoroquinolones include the possible development of Clostridium difficile infection. Now, with Clostridium difficile infections, there are 4 major culprits, the 4 C's. Okay, so with regards to the 4 C's, you will be thinking of ciprofloxacin, clindamycin, co-amoxiclav, and cephalosporins. So let me repeat them: ciprofloxacin, clindamycin, co-amoxiclav, and ceftriaxone as your major culprits for the cause of Clostridium difficile. For treatment of Clostridium difficile, you would use oral vancomycin or fidaxomicin. Oral, not IV. IV has a low absorption rate. Okay, other important side effects of fluoroquinolones or contraindications of fluoroquinolones include contraindication, do not use in cases of any thoracic aortic aneurysms or abdominal aortic aneurysms, as they increase the chance of rupture for these things. Okay, but fetal wise, remember, cartilage damage is the most important one. Okay, let's move on to the next one. Let's look at folate antagonists. So what is a folate antagonist? What pops into your mind? This would be methotrexate. Methotrexate is a folate antagonist. Methotrexate is commonly used in two major areas, rheumatoid arthritis and in the management of possible ectopic pregnancy as well. Okay, so from my previous video about ectopic surgery management, a very kind colleague had mentioned that actually with methotrexate, the fetal cardiac activity does not have to be present. Okay, fetal cardiac activity is not present, and you can use methotrexate. Okay, which I have mentioned in the comments of that video. So let's look at the teratogenic effects of folate antagonists on fetuses. So if you've heard of when a pregnant woman goes in for initial prenatal visit, or when she's applying to conceive and things, it's very important that she takes some folate medications, right? Some multivitamins such as folate medications, right? And usually you'd require a small dose such as 0.4 milligrams. Okay, if the patient is not taking folate medications, right, or in the case of using methotrexate, which is a folate antagonist, which would lower the levels of folate, you need to use an even higher dose of folate if a patient is using this. In those cases, you would see things like neural tube defects. Okay, neural tube defects. Okay, so neural tube defects, you would see, you can see a whole range of things such as anencephaly, myelomeningocele, or just the meningocele. So these are some examples of neural tube defects. Okay, so make sure these kind of patients will need a higher dose of folic acid. And coming back to actual neural tube defects from what we talked about earlier, another folate antagonist that you have to know is phenytoin. Phenytoin is a folate antagonist as well. Okay, and so is trimethoprim as well. Trimethoprim is another antibiotic. So the next drug that we can examine would be isotretinoin. So now what is isotretinoin used for? Isotretinoin is used for conditions such as nodular cystic acne or severe acne. Isotretinoin can be used, and isotretinoin is associated with a lot of side effects. So in the fetal stage, it's associated with multiple severe birth defects. Okay, multiple severe birth defects, and this is as specific as it gets through the U.S. Emily resources. But a good way to remember would be that isotretinoin has a lot of side effects. It can cause a lot of multiple a lot of severe birth defects as well. Okay. Another important side effect to note for this is the development of idiopathic intracranial hypertension. Okay, that's important as well. And if a patient is using isotretinoin, contraception is mandatory. Okay, contraception is mandatory in the use of isotretinoin. Okay, so make sure you look for the use of isotretinoin in a patient, and make sure if they're thinking, if it's a female patient, that they're using contraception. Okay. Let's look at the next one. Next one would be lithium. Okay. Now, lithium is a medication that's used in treatment of bipolar disorder. It is a mood stabilizer, and it's one of the first-line therapies for bipolar disorder. Important side effects of lithium to note in fetal development is Epstein anomaly. Okay, Epstein anomaly. It's a cardiac defect. Epstein anomaly. Okay. Other potential side effects to note are hypercalcemia. Okay, hypercalcemia. You have to note look out for nephrogenic diabetes insipidus. That is important as well. And you have to look for things such as renal impairment. Okay, if a patient does have renal impairment, should switch the patient to valproic acid, as valproate is metabolized through the liver. Okay. The next drug to examine would be methimazole. Okay. Now, methimazole is, you may have also heard of it as carbimazole. It's an anti-hyperthyroid medication, so it's medication used in hyperthyroidism. Lower your amounts of T4 and T3 that's floating around in the body. Okay, so teratogenic effects of methimazole include aplasia cutis congenita. Aplasia cutis congenita. Okay, which is congenital absence of skin. Can you believe that? Congenital absence of skin. Okay, particularly on the scalp. Aplasia cutis. How do you remember this? So now, methimazole or carbimazole, one of the important side effects to watch out for is agranulocytosis. Okay, agranulocytosis, which is basically you're having neutropenia, and you have to monitor that for the patient. And so when these patients go to the doctor, they have to get pricked a lot of times to draw blood, and so they have to keep going through the skin, right? So for methimazole, since you have to keep monitoring neutrophils and taking blood through the skin, the congenital side effect, you remember, it's to do with skin. This would be aplasia cutis congenita. Okay, so for methimazole. The next drug let's examine would be tetracyclines. So examples of tetracycline, or an example of tetracycline includes doxycycline. Doxycycline is an example of tetracyclines. Okay, tetracyclines. The most important side effects you have to know are discolored teeth. Okay, so this is contraindicated in children, and inhibited bone growth. Okay, so a nice way to remember this is that instead of saying tetracycline, you say tetracycline. Okay, tetracycline. So this would involve teeth, discoloration of the teeth, and since teeth are bones, you'd have inhibited bone growth as well. Okay, inhibited growth of bones. Okay. So next drug to examine would be thalidomide. Now, thalidomide was previously used in the 1950s as a treatment for morning sickness. Okay, but they quickly found out that it is very teratogenic because it can cause limb defects. Okay, limb defects. Thalidomide can cause limb defects. Okay, so thalidomide, you can sort of think of it in many different ways. Thalidomide. Okay, thalidomide is a nice way of remembering it. Or when someone falls, thud, thalidomide, thud, when they fall down, thud, they hurt their hand, limb defects. They fall down and they break their hand, for example. Thalidomide, thud, or thalidomide. These are ways of remembering that thalidomide can cause limb defects. Okay, And let's look at the last medication, is warfarin. Now warfarin is also known for being teratogenic. Okay, warfarin can cause bone and cartilage deformities. Okay, so you can find nasal and limb hypoplasia. So nasal and limb hypoplasia. Okay, and you can find and fetal cerebral hemorrhage. Okay. So what is warfarin? Warfarin is a vitamin K antagonist. It inhibits the factors 2, 7, 9, and 10. 2, 7, 9, and 10. Okay, these are the factors that it inhibits. So if it inhibits these factors, okay, which are clotting factors, what you can have is the patient can bleed. So cerebral hemorrhage, this is important. Now, when a baby is born, they're usually given intramuscular vitamin K as well, because babies don't have the gut flora that can produce vitamin K. So if vitamin K is not given, they are at increased risk of developing things like cerebral hemorrhage, which can be very deadly. Okay, so if you think about it that way, you can link the fetal cerebral hemorrhage to the optic nerve atrophy, in the sense that both are sort of in the same region within the CNS system. So cerebral hemorrhage, and it can cause optic nerve atrophy as well. Okay, and when you're seeing someone, you're looking at their nose, you're looking at their limbs. Okay, so with optic nerve atrophy, you're looking at less, like optic nerve atrophy. Atrophy means that there's reduction, okay, or like it's not growing well, which means when you look at something, when you're looking at something with optic nerve atrophy, it's not growing well as well. So nasal and limb hypoplasia as well. Okay, so you can link these together. So looking at the actual substance abuse, with alcohol, quite famously, Fetal Alcohol Syndrome. Now this is very harmful to the baby. Okay, so please do not use alcohol during pregnancy. With Fetal Alcohol Syndrome, the sort of classic feature that you can sort of immediately pick this up on a question is through a thin upper lip. Okay, and you may see absent philtrum as well, which is your sort of little tendon that your tongue is sort of stabilized by. Okay, so your thin upper lip and your absent philtrum. Okay, with cocaine use, you're looking at fetal abnormalities such as low birth weight. Okay, preterm birth. So preterm babies have a lot of problems when they're born, and this will be a whole another half an hour to discuss, but it will involve things like intraventricular hemorrhage, necrotizing enterocolitis, and respiratory distress syndrome. These are some of the major effects of preterm birth that you have to watch out for and prevent. Okay, another fetal abnormality you'll see is intrauterine growth restriction. Okay, and the mother is at risk for placental abruption. Okay, placental abruption, when the placenta prematurely detaches from the myometrium and causes profuse bleeding and sudden abdominal pain, which is detrimental to both the mother and the baby. Okay, so this is important. And with regards to smoking during pregnancy, okay, you would see things like low birth weight, okay, preterm labor, placental problems, intrauterine growth restriction, sudden infant death syndrome, and possible development of ADHD. Okay, now nicotine causes vasoconstriction. Okay, if there's vasoconstriction going on in the body, what would happen? You would have decreased blood flow going towards the placenta, which is required to supply all these nutrients and oxygen to the baby. If that is lowered as well, you would get things like low birth weight, preterm labor as well, placental problems, intrauterine growth restriction, and infants would be at increased risk for sudden infant death syndrome as well. Okay, and couple the nicotine with the fact that there's increased levels of carbon monoxide. Okay, increased levels of carbon monoxide, which impairs oxygen delivery. Now, this is just not at all beneficial for the baby at all. You have vasoconstriction, already decreased blood flow, and you're decreasing the oxygen delivery too, which can cause low birth weight, preterm labor, placental problems, intrauterine growth restriction, sudden infant death syndrome, and possible development of ADHD as well.